Hi friends, Dr. Arianne here from the Movement Paradigm. Today I wanted to talk about gut health because we have an amazing workshop coming up next Wednesday, the 26th from 12 to 2 at the center. So we're going to talk about restoring your gut health. We're going to use specific vagus nerve resets, reprogramming. We're also going to include lymphatic drainage. So it's going to be a really powerful workshop, so hopefully you can attend. So with that said, I've been speaking for the past few months on the functional medicine paradigm shift. So this is something that has been very, very interesting to me. I'm super passionate about. I've dealt with a lot of gut issues myself, which has led me down the path of functional medicine. So today I wanted to just discuss a little bit about gut health in general. So when we think about the statistics of America, it is really quite astounding. So we have 50% of Americans that are suffering from chronic disease, and most of them are suffering from multiple chronic diseases. We have 25 to 50 million Americans suffering from autoimmune. And then if we think more specifically about digestive statistics, we have 35 visits to the doctor for every 100 for digestive concerns. We have 43% of Americans with intermittent digestive issues. And then this one is, again, quite remarkable, is 70% of Americans have digestive-related signs and symptoms or disease. So the question is why is that happening? So I always like to talk about, what are the inflammatory triggers that are linked to chronic disease. So we know now at this point that most all chronic disease is linked to inflammation. And I've done a separate video speaking about inflammation, so I won't get into great detail. But when we think about inflammation, what are the things that cause inflammation on a daily basis? So the first and foremost is going to be food. So we have most people consuming a standard American diet, the SAD diet, which is pro-inflammatory. So it's high fat, high sugar, just processed foods. So just a really poor diet versus an anti-inflammatory diet. We have trauma, so that can be any type of chemical trauma, that could be mechanical trauma, any kind of trauma to a localized tissue or from a systemic standpoint. We have toxins. So two of the biggest toxins are herbicides and pesticides that every single one of us is exposed to all the time. Even if you don't use it at your home, you're exposed to it when you go out into the environment. On average, women use 12 products on their feet, or on their body before they leave for the day. So that's on average 168 chemicals that they put on their body before they leave their house. And men, it's not just them, you have on average 83 chemicals. So, and even female teenagers, it's even greater because they're using more products. So we have, again, so we have food, we have toxins, we have bugs, and that could be, if you think of ticks, if you think of any other kind of parasites, and then we have, again, trauma. So we have all of these things that if more things light up at one time, that can cause a greater inflammatory cycle. So again, we know that chronic disease is linked to inflammation. We know what are the things that contribute to inflammation. One of the other biggest things that has been linked to chronic disease is what we call leaky gut. And it is also called hyperpermeability. And with this, what we think of is from the digestive system, it's all the way from the mouth, through the esophagus, all the way to the anus, intestines, etc. And we have an epithelial lining within this, we call it our gut mucosa. So this epithelial lining, it has tight junctions. And when we think of the tight junctions, their role is when we break down food with enzymes, it's allowing the nutrients to pass through into the bloodstream, but not let any other pathogens or bugs or viruses or bacteria to pass through. So think of it as it's passing through the good stuff to get our nutrients to the cells. However, in the case of a leaky gut, what can happen is these tight junctions are not so tight anymore. And they let these undigested food particles, bugs, toxins, etc., into the bloodstream. And in addition to that function, whether it's going really well or not going really well, The other huge component about these epithelial cells is that we have what's called GALT, so gut-associated lymphoid tissue. So that is 70 to 80% of our immune system. 70 to 80% of our immune system is located in our gut, which is why it is so important to have optimal gut health. So what happens is, in the case of leaky gut, is again, all of these bad things are going into the bloodstream and can cause an inflammatory response. So we are now detecting all of this as foreign, the tissue is detecting these things as foreign invaders. So it creates an inflammatory response, which then can ultimately become a more systemic inflammatory response. Our immune system will create antibodies, and sometimes that can turn into our immune system attacking itself in the case of an autoimmune disease. So when this is happening, again, which is again linked to most chronic disease, we are in this constant inflammatory state. We have more inflammatory triggers that are coming at us. We have greater signaling, so that creates a more systemic response. And it can be a pathway to a lot of really, really terrible things. Some of just the small symptoms that you could experience could be anything from brain fog, depression, anxiety, bloating, food intolerances, and the list could go on. But that can also be linked, that leaky gut can be linked to, again, other things that you might be experiencing, other diagnoses, other, again, symptoms. So it's really something to look at. And, you know, personally, I have been through this journey. Leaky gut was just one of my many things that I've had, from SIBO to leaky gut to lots of malabsorption issues, which is what also can happen with leaky gut over time, is you begin not to absorb the nutrients that you are consuming. So it doesn't matter what supplement you're taking, doesn't matter what food you're eating, if you have leaky gut, over time, you're not going to be absorbing those things. So it is really, really important to look at. There's lots of literature on it, which is, you know, really, really, really powerful. So something that if you have questions about, please feel free to reach out. When we talk about a gut restoration program, which I'll do in another video, I'll talk about how to outline your steps to healing. So what is the 5R approach to gut healing, and how can you navigate that path? So thank you so much for tuning in, and have a great week. Bye.